Recently, I've been treating a family member for concussion, sports-related concussion to be specific. Not that it really matters. What we want to look at, I've had this conversation with this family member, and then I've had this conversation with lots of patients this year in particular. I don't know why this just seems to be the theme of the year. Breaking down what we need to do to clear you from concussion. What are the checklists? What are the assessments we need to see clean? And what do we need to see that you have passed so that we know at a minimum you're probably safe and probably clear of concussion. And so what that list looks like is we've got symptoms, we've got a neurological exam, we've got a concussion-specific exam, and then we've got a concussion-specific exercise test. And so if we were to break this down, symptoms, this is the post-concussion symptom scale. Usually you're going to find that in the SCAT-6 or the Sport Concussion Assessment Tool. And when we're thinking about symptoms, we're ranking the severity out of 132. So you might have a symptom severity of 51 out of 132 or 120 out of 132. When we're considering you clear, those symptoms are less than 6. So that's the first check. We've got to get symptoms to less than 6. Usually what we're doing in assessment is we're saying, hey, if those symptoms are greater than 7, as far as a symptom number, and the severity is greater than usually 35 to 39, then we're assuming you're dealing with a concussion. So when you come in for an assessment, we see that you check off more than 7 symptoms and your severity is more than 35 to 39, we're thinking in concussion territory. And then when we're looking to clear you, we need this 35 to 39 or whatever that number is to be less than 6. Now, the other thing that should be happening in your first concussion visit is a neurological exam. This neurological exam should be completely normal. There shouldn't be abnormal reflexes. There shouldn't be anything that would raise a flag that you need to go to the ER. So what we're doing with this neuro exam, and this also includes the cervical spine. So we're looking at, do you have normal range of motion? Do you have any abnormal pain or tenderness here? That would indicate the need for a CT, an MRI, or some sort of urgent. That neurological exam is abnormal. We're getting you out to some specialty imaging or specialty neurosurgical acute care because that shouldn't be abnormal after a concussion. So this is normal. Awesome. It doesn't rule concussion in or out. We just want it to be normal. The VOMS is the vestibular ocular motor screening. Now, this is something that is missed a lot unless you go to a physical therapist or a chiropractor or a naturopathic doctor who does concussion, someone who this is their kind of bread and butter, they're really literate in this space. You're going to see at minimum, you're going to see a VOMS, which is a vestibular ocular motor screening. And what this does is it helps us rule in and rule out concussion from a quantitative symptom perspective. And it also helps us kind of guide rehab. Maybe your horizontal VOR is wonky, so we're going to look deeper beyond the VOMS at your vestibular system. Maybe pursuits or saccades are wonky, so we're going to look beyond the VOMS at the oculomotor system. So you can see how it helps us diagnose and manage concussion. And what we're looking for is during the VOMS, you should not have any symptoms. No SX, no symptoms. That's good. If we're doing the VOMS and your symptoms increase more than 2 points on any of the maneuvers, then we're thinking, we're not sure it's concussion, but we're pretty sure that it's not a concussion. The no symptoms, we're like 96% sure, 92 to 96% sure you don't have a concussion. Maybe we're looking at whiplash, maybe we're looking at something else. But if your symptoms increase more than 2 points, then we're still kind of in concussion territory and we got to factor it in against everything else. As we're going through here to recap, if you want to be cleared from concussion, your symptom severity should be less than 6. You should have a normal neuro exam and you should have no symptoms on the VOMS. Now, the lie detector test here is the Buffalo Concussion Treadmill Test, the BCTT. This is looking at your exercise tolerance. After a concussion, we see that a lot of people are going to have symptoms flare between 50 and 70% of their heart rate max. And what that is essentially really light to moderate exercise. And that's not, especially for athletes, that's not where we should be having symptoms. And this isn't a symptom like I'm winded or my legs feel heavy. This is I'm nauseous, I have a headache, I feel like I'm going to fall over, I'm dizzy, things like that. And so to pass this test, some places say you should be able to reach your maximal heart rate. Across the research, we want to see that you can at least reach 85 to 95% of your heart rate max. From a functional perspective, this is where we're starting to go anaerobic. for most people. Once you kind of break 80%, for most people, you're crossing a lactate threshold. You're crossing this point where you're moving from aerobic to anaerobic performance. So then that's no longer a submaximal test. If you can get to 85 to 90% of your heart rate max with no symptoms, then you've passed this test. What we'll usually see is, again, between 50 to 70% of heart rate max, increase of symptoms. That means you're definitely not ready to return to sport, and we're going to start a subsymptom aerobic exercise program. Now, this is absolutely not everything. We also really need to consider your reaction time. We need to consider your balance. And then we also need to consider dynamic exercise tolerance for contact athletes, hockey players, football players, rugby, lacrosse, soccer, where there's a more dynamic, fast risk of injury compared to something like baseball or something like swimming, where we don't necessarily need this dynamic exercise tolerance. We just need to see this normal clearance. The contact athletes should absolutely have this before being cleared for contact practice or play. This ended up being longer than I thought, but this is what your doctor should be doing. This should not be, concussion is not only this. That's what we see a lot of times, is that during your clearance process, you're just going to be taken back into a room, you're asked some questions, you're asked about your symptoms, and if that's not normal, they send you on your way. And then you come back in 3 days to a week, and they ask you about your symptoms, and they ask you some more questions at rest, and then they send you about your day. And what we see is that the SCAT5, I don't know what the research on the SCAT6 is going to say, but I'm guessing it's going to be pretty similar, is the SCAT5 will normalize within about a week, even if none of this other stuff is normal. So when you're only relying on this, and you're only relying on symptoms, it's not a good metric for recovery, and that's why you'll sometimes have relapses, or you sometimes have this sensation of incomplete recovery, and you're not really performing normally. You're still tired, you still have headaches, you still have brain fog, you still have dizziness, whatever. And so that's where this, at a minimum, you need a neuroexam of VOMs and a Buffalo concussion treadmill test. In more advanced clinics, you're going to see reaction time balance and dynamic exercise testing for contact athletes. But this is the flow for clearing someone from concussion.